Hey guys, I'm Dr. Allen with Allen's Spine and Sport, and I'm going to demonstrate or show diaphragmatic respiration, which is the foundation or the building blocks of our DNS rehab protocols, which is what we're adding to our adjustments, manual therapies, soft tissues to make sure we can create long-lasting results. So this is kind of the first thing we work on when we're dealing with DNS specifically, or dynamic neuromuscular stabilization, so that we can move forward to the other exercises, making sure we're using all the correct muscles around the core and then the shoulders and the hips. So essentially what we have is this big muscle called the diaphragm oriented across the back of the abdominal wall. And when we breathe in, the diaphragm moves down, and as a result, air comes into the lungs and the belly should expand. And that's how we were designed to breathe. We just over time create all this tension in the neck, upper shoulders, chest, breathing up like this instead of down into the belly. So we need to retrain the brain how to use the diaphragm to its fullest extent so that we can reduce the tension in the low back or create the correct muscle activation around the core. And then just as importantly is we reduce the tension or reduce the activity in the accessory breathing muscles, the ones that do this all day long, by using the diaphragm descending down instead of moving the chest up. So how we cue it is relax the shoulder blades, and when you breathe in, I want you to imagine your lungs are in your stomach, or your stomach's a balloon and you're inflating the walls of that balloon with every breath in. So in other words, this is commonly how we'll cue it is when you breathe in, push me out. So we'll make sure we're breathing in a full cylinder, meaning the front of the abdominal wall, the sides of the abdominal wall, and then the most difficult part is the back of the abdominal wall. And this takes like 3 to 4 weeks of repetition to really make it subconscious. So what I usually tell patients is when you're sitting in a car, sitting at a desk, watching TV, taking a break, multiple times throughout the day, 10 to 15 belly breaths at a time. And once we have that pattern down, we can progress forward and move on, work on all of our other exercises to create long-lasting results in any of these conditions that we treat. Thanks for watching.